Question 1. A client with dehydration has dry mucous membranes and poor skin turgor. Which laboratory result does the nurse expect? A. Low hematocrit. B. Elevated sodium level. C. Low urine-specific gravity. D. Decreased blood urea nitrogen. Correct answer, B. Elevated sodium level. Rationale. Dehydration often causes hypernatremia due to water loss exceeding sodium loss. Strategy. Think water loss equals concentrated sodium. Question 2. A client receiving 4-potassium suddenly reports burning at the 4 site. What should the nurse do first? A. Increase infusion rate. B. Stop the infusion and assess the site. C. Apply heat immediately. D. Flush with dextrose solution. Correct answer, B. Stop the infusion and assess the site. Rationale. Potassium is irritating to veins and may indicate infiltration or phlebitis. Strategy. Pain during 4-potassium infusion is never ignored. Question 3. Which client is at highest risk for fluid volume overload? A. Client with heart failure. B. Client with migraine headache. C. Client with fractured arm. D. Client with dermatitis. Correct answer, A. Client with heart failure. Rationale. Heart failure reduces the body's ability to manage excess fluid. Strategy. Heart and kidney disorders commonly cause overload. Question 4. A nurse reviews laboratory results. Which potassium value requires immediate intervention? A. 3.8 milliequivalent/L. B. 4.2 milliequivalent/L. C. 2.9 milliequivalent/L. D. 4.8 milliequivalent/L. Correct answer, C. 2.9 milliequivalent/L. Rationale. Hypokalemia can lead to dangerous cardiac dysrhythmias. Strategy. Potassium abnormalities are cardiac priorities. Question 5. A client with fluid overload has crackles and edema. Which prescription should the nurse anticipate? A. Increase oral fluids. B. Administer diuretics. C. Restrict sodium only after discharge. D. Encourage bed rest without treatment. Correct answer, B. Administer diuretics. Rationale. Diuretics remove excess fluid from the body. Strategy. Crackles plus edema equals excess fluid removal needed. Question 6. A client's sodium level is 122 milliequivalent/L. Which symptom should the nurse expect? A. Extreme thirst. B. Confusion. C. Increased alertness. D. Dry flushed skin. Correct answer, B. Confusion. Rationale. Hyponatremia affects neurological function. Strategy. Low sodium mainly affects the brain. Question 7. Which ECG change is associated with hyperkalemia? A. Flattened T waves. B. U waves. C. Peaked T waves. D. Short QT interval only. Correct answer, C. Peaked T waves. Rationale. Hyperkalemia causes characteristic tall peaked T waves. Strategy. Peaked T equals potassium too high. Question 8. A nurse is caring for a client with vomiting for 3 days. Which imbalance is most likely? A. Hyperkalemia. B. Fluid volume excess. C. Hypokalemia. D. Hypercalcemia. Correct answer, C. Hypokalemia. Rationale. Gastrointestinal losses remove potassium from the body. Strategy. Vomiting and diarrhea often lower potassium. Question 9. A client with SATA is admitted. Which intervention is appropriate? A. Encourage unlimited fluids. B. Restrict fluids. C. Administer hypotonic 4 fluids. D. Increase sodium losses. Correct answer, B. Restrict fluids. Rationale. SATA causes water retention and dilutional hyponatremia. Strategy. SAT equals too much water retained. Question 10. A client receiving furosemide should be monitored closely for which electrolyte imbalance? A. Hypernatremia. B. Hypermagnesemia. C. Hypokalemia. D. Hypercalcemia. Correct answer, C. Hypokalemia. Rationale. Loop diuretics increase potassium excretion. Strategy. Loop diuretics lose potassium. Question 11. Which finding indicates fluid volume deficit? A. Bounding pulse. B. Neck vein distension. C. Hypotension. D. Pulmonary edema. Correct answer, C. Hypotension. Rationale. Reduced circulating volume lowers blood pressure. Strategy. Less fluid equals lower pressure. Question 12. A client has magnesium level 1.1 mg per deciliter. Which symptom is expected? A. Decreased reflexes. B. Muscle tremors. C. Bradycardia only. D. Respiratory depression. Correct answer, B. Muscle tremors. Rationale. Hypomagnesemia increases neuromuscular excitability. Strategy. Low magnesium causes twitching and tremors. Question 13. A nurse assesses a client with hypercalcemia. Which manifestation is expected? A. Hyperactive reflexes. B. Tetany. C. Muscle weakness. D. Positive Chvostek sign. Correct answer, C. Muscle weakness. Rationale. High calcium decreases neuromuscular activity. Strategy. Too much calcium slows muscles down. Question 14. Which force solution is isotonic? A. 0.45% saline. B. D5W in water after metabolism. C. 0.9% normal saline. D. 3% saline. Correct answer, C. 0.9% normal saline. Rationale. Normal saline remains in the intravascular space without shifting fluid dramatically. Strategy. No common isotonic solutions for NCLEX. Question 15. A client with hypocalcemia is at risk for A. Constipation. B. Kidney stones. C. Seizures. D. Bradycardia. Correct answer, C. Seizures. Rationale. Low calcium increases nerve excitability. Strategy. Low calcium equals twitching, tetany, seizures. Question 16. Which assessment finding suggests hypernatremia? A. Confusion and irritability. B. Muscle cramps only. C. Slow heart rate. D. Excessive salivation. Correct answer, A. Confusion and irritability. Rationale. High sodium causes neurological symptoms due to cellular dehydration. Strategy. Sodium imbalances often affect mental status. Question 17. A nurse monitors intake and output for a client with heart failure. Which finding should be reported? A. Intake 1,500 milliliters, output 1,400 milliliters. B. Weight gain of 2 kilograms in 24 hours. C. Urine output 40 milliliters per hour. D. Mild thirst. Correct answer, B. Weight gain of 2 kilograms in 24 hours. Rationale. Rapid weight gain indicates fluid retention. Strategy. Daily weight is the best indicator of fluid status. Question 18. Which food should the nurse recommend for hypokalemia? A. Apples. B. White rice. C. Bananas. D. Bread. Correct answer, C. Bananas. Rationale. Bananas are rich in potassium. Strategy. Remember high potassium foods. Question 19. A client with severe diarrhea is at risk for which acid-base imbalance? A. Metabolic acidosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Correct answer, A. Metabolic acidosis. Rationale. Diarrhea causes bicarbonate loss. Strategy. Diarrhea equals acids remain in the body. Question 20. A client has a potassium level of 6.2 milliequivalent/L. Which intervention takes priority? A. Administer potassium supplements. B. Monitor cardiac rhythm. C. Encourage bananas. D. Restrict calcium. Correct answer, B. Monitor cardiac rhythm. Rationale. Hyperkalemia can cause fatal arrhythmias. Strategy. High potassium threatens the heart first. Question 21. Which assessment finding indicates fluid volume excess? A. Flat neck veins. B. Weak pulse. C. Peripheral edema. D. Dry tongue. Correct answer, C. Peripheral edema. Rationale. Excess fluid accumulates in tissues. Strategy. Swelling usually signals overload. Question 22. A client with dehydration should receive which priority intervention? A. Fluid replacement. B. Sodium restriction. C. Potassium restriction. D. Diuretics. Correct answer, A. Fluid replacement. Rationale. Restoring circulating volume is priority. Strategy. Replace what the body lost. Question 23. A nurse assesses a client with hypophosphatemia. Which symptom is expected? A. Muscle weakness. B. Bounding pulse. C. Hypertension. D. Bradycardia only. Correct answer, A. Muscle weakness. Rationale. Low phosphate decreases cellular energy production. Strategy. Phosphate affects muscle energy. Question 24. Which client is at greatest risk for hyponatremia? A. Client using diuretics. B. Client with eczema. C. Client with fractured toe. D. Client with cataracts. Correct answer, A. Client using diuretics. Rationale. Diuretics increase sodium loss. Strategy. Diuretics commonly lower sodium. Question 25. A nurse is administering hypertonic saline. Which assessment is priority? A. Lung sounds. B. Skin color only. C. Hair texture. D. Appetite changes. Correct answer, A. Lung sounds. Rationale. Hypertonic fluids can cause fluid overload. Strategy. Watch for pulmonary edema with hypertonic solutions. Question 26. Which finding suggests hypokalemia? A. Muscle weakness. B. Peaked T waves. C. Increased bowel sounds. D. Irritability only. Correct answer, A. Muscle weakness. Rationale. Low potassium impairs muscle contraction. Strategy. Potassium problems affect muscles and heart. Question 27. A client has positive Trousseau sign. Which imbalance is suspected? A. Hypernatremia. B. Hypocalcemia. C. Hypermagnesemia. D. Hyperkalemia. Correct answer, B. Hypocalcemia. Rationale. Trousseau sign indicates neuromuscular irritability from low calcium. Strategy. Tetany signs point to calcium deficiency. Question 28. Which drink is best for a client with dehydration from exercise? A. Coffee. B. Alcohol. C. Oral rehydration solution. D. Energy drink only. Correct answer, C. Oral rehydration solution. Rationale. Electrolyte-containing fluids replace losses effectively. Strategy. Replace both water and electrolytes. Question 29. A nurse notes absent bowel sounds in a client with hypokalemia. Why does this occur? A. Increased muscle contraction. B. Reduced smooth muscle activity. C. Excess sodium retention. D. Increased nerve conduction. Correct answer, B. Reduced smooth muscle activity. Rationale. Low potassium slows gastrointestinal motility. Strategy. Hypokalemia slows everything down. Question 30. A client receiving 4 fluids develops crackles. What should the nurse do first? A. Increase fluid rate. B. Stop or slow the infusion. C. Place client flat. D. Encourage oral fluids. Correct answer, B. Stop or slow the infusion. Rationale. Crackles suggest fluid overload. Strategy. Too much fluid equals reassess infusion immediately. Question 31. Which symptom is associated with hypermagnesemia? A. Hyperactive reflexes. B. Respiratory depression. C. Seizures. D. Tremors. Correct answer, B. Respiratory depression. Rationale. High magnesium depresses neuromuscular function. Strategy. Excess magnesium slows body systems. Question 32. A client with metabolic alkalosis is most likely experiencing A. Prolonged vomiting. B. Severe diarrhea. C. Kidney failure only. D. Hyperventilation. Correct answer, A. Prolonged vomiting. Rationale. Vomiting causes acid loss. Strategy. Loss of stomach acid equals alkalosis. Question 33. Which finding indicates improvement in dehydration? A. Decreased urine output. B. Moist mucous membranes. C. Tachycardia. D. Poor skin turgor. Correct answer, B. Moist mucous membranes. Rationale. Hydration improves tissue moisture. Strategy. Hydration signs normalize as fluid improves. Question 34. A nurse is caring for a client with renal failure. Which electrolyte imbalance is most concerning? A. Hyperkalemia. B. Hypocalcemia. C. Hypophosphatemia. D. Hypernatremia. Correct answer, A. Hyperkalemia. Rationale. Kidneys cannot excrete potassium effectively. Strategy. Renal failure often raises potassium dangerously. Question 35. Which intervention is appropriate for a client with fluid restriction? A. Offer large pitchers of water. B. Provide frequent oral care. C. Encourage salty snacks. D. Increase caffeine intake. Correct answer, B. Provide frequent oral care. Rationale. Oral care relieves dryness without excess fluid intake. Strategy. Comfort measures help restricted clients. Question 36. A nurse reviews arterial blood gases, pH 7.30, HCO3 18. Which imbalance is present? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Metabolic alkalosis. Correct answer, B. Metabolic acidosis. Rationale. Low pH and low bicarbonate indicate metabolic acidosis. Strategy. Rome, respiratory opposite, metabolic equal. Question 37. A client with hyperphosphatemia should limit which food? A. Dairy products. B. Apples. C. Lettuce. D. Berries. Correct answer. A. Dairy products. Rationale. Dairy contains high phosphorus levels. Strategy. No foods linked to electrolyte levels. Question 38. Which finding suggests hypomagnesemia? A. Decreased reflexes. B. Cardiac arrest risk. C. Lethargy only. D. Bradycardia only. Correct answer, B. Cardiac arrest risk. Rationale. Low magnesium may trigger severe dysrhythmias. Strategy. Magnesium helps stabilize the heart. Question 39. A client has edema, hypertension, and jugular vein distension. Which condition is likely present? A. Fluid volume deficit. B. Fluid volume excess. C. Hypocalcemia. D. Dehydration only. Correct answer, B. Fluid volume excess. Rationale. These are classic overload signs. Strategy. Think too much fluid in circulation. Question 40. Which action is safest when administering 4-potassium? A. Give 4-push potassium. B. Infuse rapidly. C. Use infusion pump. D. Mix with blood products. Correct answer, C. Use infusion pump. Rationale. Controlled infusion prevents cardiac complications. Strategy. 4-potassium must never be pushed rapidly. Question 41. A client with hypovolemia may exhibit A. Bounding pulse. B. Tachycardia. C. Weight gain. D. Hypertension. Correct answer, B. Tachycardia. Rationale. The body compensates for low volume by increasing heart rate. Strategy. Low fluid equals faster pulse. Question 42. Which electrolyte imbalance commonly occurs with alcoholism? A. Hypercalcemia. B. Hypernatremia. C. Hypomagnesemia. D. Hyperphosphatemia. Correct answer, C. Hypomagnesemia. Rationale. Alcohol abuse frequently lowers magnesium levels. Strategy. Alcoholism often depletes magnesium. Question 43. A nurse is teaching foods high in calcium. Which food should be included? A. Yogurt. B. White bread. C. Rice. D. Applesauce. Correct answer, A. Yogurt. Rationale. Dairy products are rich calcium sources. Strategy. Calcium-rich foods strengthen bones and nerves. Question 44. A client with hypernatremia should be monitored for A. Cerebral edema during correction. B. Tetany. C. Muscle spasms only. D. Low urine output only. Correct answer, A. Cerebral edema during correction. Rationale. Rapid sodium correction can shift fluid into brain cells. Strategy. Correct sodium imbalances slowly. Question 45. A nurse notes Chvostek sign in a client. What does this indicate? A. Hyperkalemia. B. Hypocalcemia. C. Hypermagnesemia. D. Hypernatremia. Correct answer, B. Hypocalcemia. Rationale. Facial twitching after tapping facial nerve indicates low calcium. Strategy. Chvostek and trousseau equals low calcium clues. Question 46. A client with fluid overload should limit A. Sodium intake. B. Protein intake only. C. Potassium-rich foods only. D. Vitamin supplements. Correct answer, A. Sodium intake. Rationale. Sodium promotes water retention. Strategy. Salt pulls fluid into the body. Question 47. Which client is at greatest risk for metabolic acidosis? A. Client with severe diarrhea. B. Client with vomiting. C. Client with anxiety hyperventilation. D. Client with pneumonia only. Correct answer, A. Client with severe diarrhea. Rationale. Diarrhea causes bicarbonate loss. Strategy. Lower bicarbonate equals acidosis. Question 48. A nurse monitors a client receiving calcium gluconate. Which assessment is priority? A. Cardiac rhythm. B. Hair texture. C. Appetite. D. Skin dryness. Correct answer, A. Cardiac rhythm. Rationale. Calcium affects cardiac conduction. Strategy. Electrolyte replacements often require heart monitoring. Question 49. Which finding indicates effective treatment of hyperkalemia? A. Potassium level 4.3 milliequivalent/L. B. Peaked T waves continue. C. Muscle weakness worsens. D. Cardiac dysrhythmias increase. Correct answer, A. Potassium level 4.3 milliequivalent/L. Rationale. This value is within normal range. Strategy. No normal electrolyte ranges. Question 50. A nurse is assessing a client with dehydration. Which urine finding is expected? A. Pale dilute urine. B. Low specific gravity. C. Dark concentrated urine. D. Excessive urine output. Correct answer, C. Dark concentrated urine. Rationale. The kidneys conserve water during dehydration. Strategy. Dehydration produces concentrated urine.